Almost everybody loses a tooth or two during a lifetime. The most well-known way to replace a missing tooth is placement of a fixed bridge. Just like a bridge across the stream, the dental fixed bridge connects to strong teeth on each side of the space. This video will describe the concept of fixed bridges. It'll provide information about the alternatives to consider instead of a fixed bridge, and it will demonstrate to you the types of bridges available. After you complete viewing of the video, please consult with your dentist to obtain further information and specific recommendations relative to your special clinical situation. You're observing two views of a patient with one missing tooth on the upper left side of her mouth. The white material is a temporary cement the dentist has placed. A bridge is planned to span from each of the strong teeth adjacent to the missing tooth area to replace the tooth that has been extracted. The patient's teeth on each side of the space have been prepared by the dentist, and an impression of the prepared teeth was made in a rubber-like material. The impression is then sent to a dental laboratory for fabrication of the bridge. Both the inside and the chewing surface of the finished bridge is shown as it was returned from the laboratory. Now the bridge has to be cemented into the mouth, and it will then become a part of the patient's body. It cannot be removed by the patient. Well-made fixed bridges are very difficult to detect from natural teeth. The patient feels like it's his or her own teeth. Note the bridges as they were made by a dental laboratory technician and the aesthetic result as they were cemented into the mouth. The patient should expect many years of service from these bridges. The most desirable alternative for fixed bridges is placement of a dental implant followed by a crown on the implant. This type of restoration costs about the same as a fixed bridge for the same missing tooth. The teeth next to the implant do not have to be prepared or trimmed down by the dentist. Surgery is required to place the implant, and a waiting period of up to 6 months may be required for the implant to grow into the bone. As present with any surgical procedure, there are minor surgical risks involved with implant placement. Please discuss those with your dentist. They are small. There is also about a 5% possibility that your body will not accept the implant. Again, very infrequently does that happen. However, after millions of implants placed around the world, dental implants are well proven and successful overall. Removable bridges or removable partial dentures are an alternative for fixed bridges. These appliances come in and out of the mouth for cleaning several times every day. They're usually less expensive than fixed bridges. They do not require significant trimming or preparing of the surfaces of the natural teeth. Usually patients are not as satisfied with removable dentures as they are with fixed bridges. When you have a missing tooth, you may elect to do nothing about it. You will suffer both functional and aesthetic challenges because the teeth next to the missing tooth drift toward one another, reducing your chewing ability and potentially causing loss of the teeth next to the space. Doing nothing is not a good choice. Fixed bridges require significant expertise on the part of both the dentist and the laboratory technician. The cost of fixed bridges is significant, but they serve patients well for many years, and they serve with both strength and with beauty. Cost of the various types of bridges does not differ much from one to the other. The porcelain fused to metal fixed bridge is by far the most used form of fixed bridge in dentistry. The dental model you're observing has one missing tooth in the front part of the mouth. The teeth on each side have been prepared by the dentist for a fixed bridge. The piece of metal is a reinforcement of that tooth. The fixed bridge has ceramic fired onto metal on the inside of the bridge. Notice how the missing tooth is well replaced by the fixed bridge. There are many types of metal that can be used underneath the ceramic on the surface. The metal provides strength, and the ceramic provides the appearance of natural teeth. Notice the gold-colored alloy on the inside of the bridge. This color will not be observed when the bridge is cemented. The chewing surface of the bridge has the anatomical characteristics, grooves, and minute stains that make the bridge look just like a natural tooth. The teeth to support the bridge have been repaired and trimmed down by the dentist. And the final cemented bridge is both strong and beautiful. It has only a few disadvantages. The ceramic may slowly wear the opposing tooth structure on the other arch more than it wears itself, but this is not a major point in most situations. A very small percentage of porcelain fused to metal bridges lose some of the ceramic during service, but you must traumatize them or in some way break them with force. As with any crown placement, there's a small chance that root canal therapy may be required later. Overall, porcelain fused to metal bridges serve in an excellent manner for many years. This type of fixed bridge is growing in popularity, but it is not as popular as porcelain fused to metal bridges. Your dentist may suggest an all-ceramic bridge if you have metal allergies. Additionally, some types of all-ceramic bridges may have slightly better aesthetics than porcelain fused to metal bridges. Some all-ceramic bridges are weaker than porcelain fused to metal bridges. However, zirconia-based all-ceramic bridges rival porcelain fused to metal bridges in strength and beauty. Ask your dentist about them. Occasionally, there is a desire or a need to place a bridge that does not require significant preparing of the teeth next to the missing tooth. Such bridges are called various names, including Maryland bridges or resin-bonded bridges. These bridges may be made of ceramic, resin, or porcelain fused to metal. Only a few situations will allow their placement. Ask your dentist if this type of bridge would serve you. Although conservative bridges do not require preparing teeth next to the missing tooth, usually they are not as strong as conventional bridges, and they may require re-cementation from time to time. The well-made resin fixed bridge you are observing was made for a patient who grinds his teeth severely. Resin does not wear opposing tooth structure and is indicated in situations of severe aggressive chewing habits. Usually, however, resin bridges are not as strong or long-lasting as porcelain fused to metal or some all-ceramic bridges. You have just observed porcelain fused to metal bridges, all-ceramic bridges, conservative bridges, and resin bridges. Please discuss your situation with your dentist and receive further guidance on the best type of bridge for your situation.